Hello and welcome back to Straumann Live at IDS. My name is Dr. Artemis Atkins, and from the Arena of Confidence, I have the pleasure to join Dr. Piano, Dr. Faqir, and Dr. Frosecchi with the program to discuss the BLX and their experience in challenging anatomical situations. Welcome to the program, gentlemen.
Good morning.
Good morning. So before we begin, as usual, I would love it if you guys would take a moment and introduce yourself to our audience. Please, Dr. Piano.
Hello, my name is Sergio Piano. I'm from Genoa, Italy, where I have my private practice. And I like to say that I am a dentist who takes care of patients at 360 degrees with a special passion for implantology. I started to play with implant more than 25 years ago, and I'm still in love with them. I am an ITI fellow, and I'm proud to be a fellow ITI.
Thank you. Dr. Faqir?
Thank you. My name is Abid Faqir. I practice in the UK, primarily in Scotland. My practice is focused on implant therapy, primarily on the immediacy solutions throughout the surgeries. And I've been practicing implant dentistry for 15 years. Currently, I'm also the president of the Association of Dental Implantology, which is one of the largest dental bodies in the UK. And I'm delighted to be here.
I'm delighted to have you. Dr. Frosecchi, would you please introduce yourselves to our audience?
Yes, my name is Massimo Frosecchi. I work in Italy, Florence, and my working life is shared by many different areas of implantology and prosthetics. I work with the University of Genova, and we go in many different countries to lecture. Me too, I'm a fellow of ITI. I'm very proud of this career in ITI. And we are very excited to be here and sharing some knowledge and some experience.
I am as well. Thank you so much. So, Dr. Faqir, with his short experience, no kidding, you're young. As a young clinician, he's already got about 10 years worth of full arch treatment experience, and both Dr. Piano and Dr. Frosecchi about 20 years, if I've understood correctly, correct?
Yeah.
Great. I am the most junior of the bunch. Okay, so the first question, I wanted you, Dr. Piano, in your last session, you mentioned today's patient has increasing expectations for treatment outcomes. Would you summarize what you mentioned in the last session to set the stage for this conversation?
Yes, exactly. You told the truth. Patient expectations are increasing in the last few years, and patient wants more. They want to have a comfort during their surgical procedure, and after the surgical procedure, they do not accept to suffering, to have pain during this phase. In addition, they don't want to dress any removal prosthesis during all the phases of the treatment. So first thing is the comfort that is changing. The second is that the patient wants to reduce the time of the treatment. They want to go straight to a provisional rehabilitation, skipping the phases related to placing the implant, waiting for osseointegration, and first of all, extracting the teeth, waiting for the healing, placing the implant, and then the traditional timing of the implant place. They want to go straight to a final provisional restoration. The third point is the aesthetic expectations that are higher and higher. Patients want to smile, not only to chew, and for this reason, they want to receive beautiful teeth in a perfect environment.
Yes, and
this
fast.
is, I think, the main thing that every dentist must keep in mind.
I agree. And we discussed in the last session that patients these days, their access to information has completely shifted the dynamic for care between a doctor and a patient's relationship. You know, it used to be that we were the ultimate sort of point of information, and now it's Dr. Google and Dr. Facebook and Dr. whatever else is out there. So yes, I agree.
It is.
Dr. Frosecchi, as you know, in treatment of full arch rehabilitation, sometimes patients who are either of hopeless dentition and soon to be edentulous, or who've been edentulous for many years, there are anatomical challenges. In your experience, talk about how you help manage this so that you have the key to success to give them the outcomes they're desiring.
I think that in this kind of big rehabilitation, the key factor is to understand as soon as possible the expected results.
Yes.
So we start from the end, from the prosthesis, from the expected result for to understand if it fits with the patient expectation, with our expectation, with our skill. And then so after this very, very sophisticated planning and even considering psychology aspects of the patient, we move to a solution that is very customized on every patient. We don't have a receipt for all the patients. We customize a lot. And for hopeless dentition, I think is one of the main indications for me for immediate loading, for a psychological aspect of the patient who's not interested to decrease the quality of his life even before to increase again. So we won't just increase the quality of life. So we move very often to an immediate loading treatment. For long-term edentulous patients, sometimes, even in this case, we talk a lot with the patient, we take care of many different solutions, and sometimes even removable solution can be very, very interesting for these patients. Other times, we can move to full arch, but with conventional, or in other cases, immediate loading. But we have many different options on long-term edentulous patients. So it changed a lot, in my opinion.
Yes. Very good. Thank you so much. Dr. Faqir, you have been using the BLX system for some time now. And I want to know, in your experience, first of all, how are you feeling about the system? And also, how is it helping you manage the expectations and the treatment outcomes that you're desiring and planning?
Yeah, first of all, the thing is that my experience has been extremely positive. My practice is centered around patient-focused treatment. That means giving patients what they desire. And the majority of my patients want immediate solutions, want to leave with teeth, definitely not dentures. So the BLX system has given me predictability. It makes the solutions for my patients predictable, allows me to have confidence in delivering that solution from every time, and it's been exceptional. You know, we've done many cases now using multiple implants, full arch, single teeth, posteriors, and the experience from every solution has been similar. Very positive, very positive.
Very good. Thank you so much. Dr. Piano, I kind of asked you this one last time, but I'm going to ask you again because I like the answer. Is what Dr. Faqir is saying consistent with your experience of the BLX system?
I agree with you. I want only to add one point. I think that in my experience treating the full arch dental patient, the main challenging thing is be able to assure to the patient the possibility to have an implant with an optimal stability in order to deliver an immediate load. This is a point that is not sure until you have placed the implant and have reached the optimal stability. Thanks to the implant, this fear, this problem, in my personal everyday practice, is solved because with this implant, I'm pretty sure to be able to reach the ideal stability and to be able to assure to the patient what he expected to have.
That's right, because as we mentioned, we were with the BLX core team here yesterday, and one of the things Dr. Christian Jari, my colleague, shared is so true. He said, you know, we never want to show up to the patient's care and not be able to deliver what we said we would, and then have to say, I'm sorry, it didn't work out. But blah, blah, blah. It's a terrible feeling that clinicians know very well. It's not a good feeling. So
it happened to me a couple of times, and the patient was not happy at all.
No, of course. Because look, they're what they come for.
He knows in advance that it would be possible, but he's not happy.
So the fact that the BLX implant system increases predictability for the outcome of primary stability, so we can actually give them the teeth, that's what they're wanting. I agree. Thank you so much for sharing that again. And Dr. Frosecchi, so the BLX system offers a really wide range. So from 3.5 millimeters to 6.5 millimeters diameters, and from 6 to 18 millimeter lengths. I want to know, in your experience, how important is it to have this broad range to solve different types of clinical situations?
Yeah, I think we are every day facing a lot of challenging situations. So to have this wide portfolio of solutions, to have this wide range of tools, I think it facilitates a lot our job, because we can start from a sort of conventional implant with a 3.5 that is rock solid. So we have a conventional but a super implant, even either in a quite narrow implant. We move to a very, very aggressive thread implant with a bigger one that is, in my opinion, more indicated in pod extraction side, in fresh socket side, when we want to achieve a very high primary stability, or even to make something more sophisticated like immediate loading or immediate restoration. So it's like to have many, many different arrows for our bow. We can, even with a single system, face a very, very big number of different situations.
Right. And the more challenging, the more range you kind of need to address.
Customize
Yes.
as more as possible, because
Yes.
Pro Arch concept in our way of
Already,
thinking
yes.
is something individual.
Yes, exactly. Already designed to be as customizable as
Yeah.
possible. I agree. Dr. Faqir, I want to know from your perspective, how does the wide variety, especially in terms of course, the diameter, the length, but also the one platform, the one connection, how does that offer you flexibility during surgery?
I mean, one of the major things when you're doing full arch treatment is the unknown, what you're going to find in terms of the bone quality, in terms of where the bone's going to be used for placing implants, and the wide range of implants is definitely a massive plus with the system. Also in extraction sockets. But for me, over the past short while, I've been using BLX. The 3.75 implant has started to become a real part of my armamentarium.
Yes.
The rock solid
Your
nature, the surface is fantastic. And then, as you mentioned, the one connection, one restorative platform, to have that ability, it makes things easier, more predictable, and much more user-friendly.
Very good.
Definitely.
Thank you so much.
Yeah.
And thank you guys both for mentioning rock solid, because the idea that, we mentioned this in a prior session, but the idea that you have about a quarter of the incidence of fractures compared to all systems, cut that by 3/4. We said the other day, you know, you don't have to be a clinician, but you can understand how terrible it would be to have an implant that fractures in the patients and it's already S integrated. Now you have to go chase. So thank you for sharing about rock solid and the value it brings to the narrow diameter implants especially. Okay, so Dr. Piano, very soon, as we mentioned in June, BLX will be available guided, fully guided.
Yeah.
I would like to know, as one of the pilot users, especially with co-diagnostics and as part of the guided surgery for the BLX system, how important is this for you, for your treatment planning and for your outcomes?
I think that the use of computer-guided surgery and computer-guided planning is fundamental for improve the planning of our case. As I said 1 hour ago on this podium, I think we need to start for the prosthetic planning, and also Massimo has said the same concept before. And in order to maximize the possibility to realize and to create the project that we have done into the stage of the planning, I think that importing this project into the guided surgery system is very, very important, because we need to transfer the pre-visualization into the final result into our computer, and then we can easily stick to this ideal setup during all the phases of the treatment.
Agreed.
It means that at the end of the story, it will be easier to develop the prosthetic phase that, in my experience, after the implant placement, is the longest in the whole procedure of immediate loading, because the adaptation, the adjustment after the implant placement to deliver the prosthesis with the traditional system is a little bit challenging. Thanks to the computer-guided surgery, this procedure it is really smooth, simple, and there is a great reduction in terms of time and a great improvement in terms of quality.
Outcomes, exactly, I agree. Precision and outcomes, I agree. Dr. Faqir.
Yeah, I mean, absolutely, absolutely agree with everything Dr. Piano has said to us. I think what we have to understand is that there's no doubt we have the rock solid nature of the implant. We have an amazing surface. The engineering of the implant gives us great stability, but we still have to execute. And having guided surgery gives us a predictability and the precision to deliver what we're planning. So I do a lot of smile design, digital smile design, use stackable guides, and I think this together with BLX will make everything just precise.
Very cool. Thank you so much. Okay, Dr. Frosecchi. We joked earlier that Dr. we were going to have Prosecco with Dr. Frosecchi. Okay, Dr. Frosecchi.
Sometimes computer correct Frosecchi into Prosecco.
The computer knows best.
But
You
it's
should just
okay,
drink a
we will
lot of
drink
Prosecco.
later.
Yes, we will. Okay, something I want to address with you in particular is related to biomaterials.
Yeah,
You're an active speaker for BOTIS.
yeah.
I want to know, in terms of immediate procedures, what role do biomaterials play for you, and if you could share with our viewers some of your practice.
Yeah, of course. Immediacy, it means very often to face areas with some bone defects,
Yes.
especially when you extract tooth, when multiple roots tooth. So there are some indication for using or not using biomaterials, so it's not for all the cases, but very, very often we have to improve the hard tissue and the soft tissue.
Exactly.
I could say that nowadays probably sometimes we have more fear in long term about the soft tissue quality and quantity instead of the hard tissue, because we have such wonderful implants that we don't need so much bone nowadays, because we have short implants, narrow implants,
Really
big threads.
wide range, yes.
But about the soft tissue, we cannot make compromises for medium and long term. So very often we use biomaterials, and we have in BOTIS portfolio a lot of nice materials, especially for soft tissue improvement, for volume and keratinization. So when we started with implants many years ago, we didn't use so many devices.
Right.
But as more we know about complication and more we won't like to pay an insurance, using more biomaterials to stay out from problems. And all these biomaterials can help a lot.
Agreed. Thank you so much.
Welcome.
Now I have a kind of an overall question for all three of you. First thing about the BLX system, as we were working out how to commercialize it, the promise of the BLX system is confidence beyond immediacy. Because as you all know, we end up applying and needing to apply an implant system to all types of different protocols. So it needs to, obviously, it's perfected to give you the highest primary stability. It's perfected for immediate stability, for immediate treatments. However, it offers confidence beyond immediacy. I want to know from each of you, do you feel that it delivers on this, and what does this mean for you? Dr. Piano.
Yes, I would like to underline 2 points, in my opinion, that are very important. The first is that the confidence means make the dentist sure to be able to place the implant in a correct way, be able to find the result that was requested by the patient. I think this is very important. This is the first point.
Help the clinician.
And the second point is the sense of reliability that gives you this implant, because the strength that transmit this implant assure you to be on a safe plan, and this sensation very often is transmitted to the patient. I think this is very important.
Very nice. Dr. Frosecchi, you do it next. I'll come back to you. Confidence beyond immediacy for the BLX implant system. What does this mean?
Immediacy, I think immediate placement or immediate loading only rarely is a necessity. Yeah? But when you decide to practice something like immediate loading or immediate placement, it's a deal with the patient.
Yes, it is.
So you cannot just try. Huh?
Yes.
We cannot talk with the patient, we are just trying.
No.
Because
They're
we
not
are-
lab animals.
Yeah. So confident, I think to get confident with one tool, with one device, with one procedure, it means to be in control of what it happens during the surgery and during the prosthetic final outcome. So these kind of tools, I think, help you a lot to get confident in this kind of procedure, especially when you don't have so much experience, because immediacy need experience and skills. It's not for everybody, but this kind of tool keep a little bit more simple the procedure.
Yes. And before I have you answer, I wanted to comment on this. You know, we had conversations around the level of experience to engage immediate procedures also in Straumann, and of course I do with colleagues all the time. And you know what, everything new, every new innovative treatment protocol, every new system requires experience.
Yeah.
There's a big difference between expertise and experience. In my view, expertise we all have. We're dentists, we know how to work with our hands, we know how to apply things, objects to clinical situations that deal with biology and physiology. Everyone who wants to try something new in terms of a product or a protocol has to gain experience, has to start from somewhere.
Of course.
The BLX system for me is a system that allows you to gain that experience and meet the protocols with the highest predictability and best potential outcomes. That for me is already a huge offering from the system. Agree?
Yes,
Absolutely.
Definitely.
Absolutely.
Dr. Faqir, may I please have you share what confidence beyond immediacy for the BLX system means to you?
I'm going to take the word experience in a slightly different context here. The experience the patient has in your practice
Also, that's right.
is
Agreed.
fundamental
Yes.
to everything we do. And BLX gives me confidence,
Yes.
gives my staff the confidence, gives the patient the confidence that the solution that we say we're going to deliver, they're actually going to get. And to have that ability and to have that patient share that experience with others, I think is fundamental.
Yes.
I think it puts my practice and all of us one step ahead of others.
You know, we shared yesterday with some of our colleagues that, you know, when the patient comes to us, they don't really know what tools we're using.
Yeah.
They just come because they trust,
Absolutely.
right? They trust the doctor. It's our choice to choose what materials and options we choose. I agree with you that in the end, it's our responsibility to pick the best offering on the market for the treatment protocol and solutions that we need for their outcomes to be met. I agree. Okay, now this one's a little more fun. Last question. I want to know from each of you 3 words to describe the BLX system, starting with Dr. Frosecchi, because I want him to buy me a Prosecco later. Okay, Dr. Frosecchi, 3 words about the BLX system.
I think as the first, we can say that it's predictable, the stability and the result in this kind of challenging situation. And this, the second, bring to the second word, that is new possibilities.
Yes.
Because as more, we want to have a wide portfolio to have more possibility. And the last one, that is a little joke, we were used to have with tissue level for many years a Ferrari, where you need a very smooth road, everything perfect, and we were very confident.
What kind of car we have now?
I don't have a Ferrari, unfortunately.
You should run out there and buy one.
Yeah, but I would like. Anyway, with tissue level, we had a Ferrari, with bone level the same. Now we have with this tool, at the first image, in my opinion, it looks like an off-road. To go in
Everywhere.
unexpected
Everywhere.
lands.
This is an
You
off-roader.
can go everywhere, but thank God, we have the same surface, the same material, so it's a Ferrari with big wheels.
Ooh, I love
Okay.
this.
Nice.
Good job.
Okay.
Okay, top that, Dr. Piano.
For me,
3 words.
yes, my 3 words are starting all of them with S.
Okay.
The first is stability. We already spoken about this. It is an implant that allows you to stabilize perfectly the implant and perform the procedure that you have planned to. The second is strength.
Yes.
Strength because it transmits a sensation of power, and I think that when you manage this implant, you feel this sensation very
Yes.
strong. This is something that is immediate when you start to
has
place
a
the implant.
really
Yes,
great-
this is the feel
it
that
does.
it is working really well. And so this is something that is very difficult to explain, but it's a feeling that you have when you place
All
this implant.
clinicians out there who are tactile people know exactly what you mean.
And the third word is safety. Safety in terms of be sure during my immediate loading procedure to eliminate the risk not to be able to perform immediate loading. When I perform a procedure of immediate loading, I have a lot of things to take care of from the beginning to the end. If I manage to reduce the thing I worried about, I'm very happy and my procedure is smoother and easier and more relaxed.
I love it. Thank you to you too. Okay, Dr. Faqir, you're up. 3 words, BLX system.
You want me to stick to 3 words?
You
Simple.
can use 3 minimum. How about this?
3.
3 minimum.
I'll keep it to 3. Patient-friendly solution. There you go.
Wow.
Wow, so quick.
Okay, succinct.
Minimalism. Minimalism.
Minimalism. Yeah.
Less is more.
That-
less is
okay.
Less is more.
I like
absolutely.
it. I like it a lot. Thank you, gentlemen, very much. That was my final question. Do you have any last thoughts you want to share with our audience? All good?
Thank you. All good.
Okay.
Thank you.
So, a great big thank you to Dr. Sergio Piano,
Thank you.
Massimo
Frosecchi.
I know! Frosecchi, who's going to give me Prosecco later,
Yeah.
and Dr.
Okay.
Abid Faqir. Thank you guys so much.
Thanks so much.
Thank you
And
for the
on that
invitation.
note, from the Arena of Confidence, I'm Dr. Artemis Atkins, and on behalf of Straumann Group, I wish you well. I'll see you soon. Thank you so much.
Thank you.
Thank you.
Thank you.